I am Dr. Bhanu Kiran Reddy, Consultant Cardiologist at SLG Hospital. Today we will discuss about Coronary Artery Disease, which is the medical term for heart attack or myocardial infarction. First we will know what is Coronary Artery Disease. Coronary artery disease is characterized by formation of blocks in the arteries supplying the heart, which are known as coronary artery disease. These blocks develop due to deposition of cholesterol and various cells like white blood cells, platelets in the blood vessels, thereby leading to formation of the blocks and causing decreased blood supply to the heart. This can present in the various forms, like coronary artery disease can be divided into unstable angina, ischemia or acute myocardial infarction. So what are the risk factors for this coronary artery disease? The risk factors can be divided into modifiable and non-modifiable risk factors. Like non-modifiable risk factors include age. With increasing age, the incidence of coronary artery disease increases. Then sex. The coronary artery disease is more common in males up to the age of 50, but after menopause, the incidence of coronary artery disease is same in men and women. Then genetic factors. There are certain genes which run in families which keep the members of particular family at increased risk of heart disease. Then the family history. This is the most important thing. Family history is defined as history of heart disease in families in men less than 55 years of age and in females less than 65 years of age. Such families have increased risk of coronary artery disease or acute myocardial infarctions, and members of such families should be more careful about their health. Then non-modifiable risk factors. This includes diabetes, hypertension and cholesterol. These three are important as these diseases don't have any specific symptoms and they are diagnosed when people go for general checkups. So it is always advised to go for general checkups at least yearly once they cross 40, and if there is any family history running in their families, it's ideal to start health checkups at least twice yearly once they cross 30 years of age. Then obesity. Obesity is also an important risk factor, and obesity can lead to uncontrolled diabetes, uncontrolled hypertension and uncontrolled cholesterol levels. So obesity should be watched for and it should be kept under control. Then lack of physical activity. Mainly, physical activity is advised to reduce the risk of any form of heart disease, and the duration advised is at least 30 minutes of cardiac activity at least 5 days per week. The cardiac activity includes walking, jogging, swimming, cycling or any other form of cardiac exercise can be done. Then stress. Stress is the most important risk factor in the present world, and this is the main reason for increasing incidence of heart disease even at very young age. And stress can be dealt by two things. One, by doing regular physical activity, and another by taking breaks from the work or by taking help of a psychiatrist. We can go away from stress. Then what are the symptoms? Coronary artery disease may present in the acute form or chronic form. Acute form mainly includes acute heart attack. It can be identified by the most common symptom is the chest pain or difficulty in breathing. The character of chest pain will be central or retrosternal area, and the character will be heaviness or squeezing type of pain which can radiate to left upper limb or to the epigastrium or back or neck. So if any person with a retrosternal chest pain of any character, it's always ideal to get an ECG done at the earliest phase, at the earliest possible time, so that we can prevent damage and identify acute heart attacks at the earliest, as there is a golden hour for treatment of the heart failure. If we can identify it early and treat it early by doing a stenting or a bypass surgery, we can avoid residual damage to the myocardium, and that period is less than 3 hours. So anyone with a acute onset chest pain at workplace or at home should always go to a center where the ECG facility and a cath lab facility is available, so that once if an acute MI is diagnosed, they can undergo a procedure at the earliest time and save their heart from residual damage. And some patients, especially in diabetics and females, chest pain is less common compared to other symptoms. They can present with difficulty in breathing or only sweating or it can even be burning type of chest pain. So any kind of chest pain, once if there are any risk factors like diabetes or hypertension or dyslipidemia or obesity or lack of physical activity or stress, it's always ideal to go for an ECG, which is a simple test and is available just for 200 rupees. So by getting an ECG, we can at least rule out acute myocardial infarction. And any other form of CAD like unstable angina or non-ST elevation MI can be diagnosed with time and can be treated, maybe even within 12 to 24 hours. If they are treated, it is useful to the patient. But for acute MI, if it is treated within less than 3 hours of time, we can avoid residual damage. These are the symptoms of MI. What are the complications? Any patient, if he has chest pain and neglects, there is a high possibility of sudden cardiac death, which can be due to acute sudden stoppage of the heart or due to arrhythmias. Arrhythmias are irregular beating of the heart, where the heart rate may go up to 200 and it will lead to sudden stoppage of the heart and death of the patient. And there can be other complications like rupture of the heart or rupture of the interventricular septum. Then what are the various modalities available? As we already discussed, for acute MI, once it is diagnosed, they should be treated by doing an echocardiogram to know the LV function. Then they can be taken up for primary angioplasty. Primary angioplasty is a procedure which is done at the earliest period, wherein we do a coronary angiogram, which is an invasive procedure where we take X-ray photographs of the blood vessels supplying the heart, known as coronary arteries. If there is any blockages, we remove those blockages either by doing emergency stenting. The earliest we do the stenting, it is always ideal for the patient to prevent any residual damage. If the blocks are more, like if the 3 vessels are blocked or if the main arteries are blocked, and if stenting procedure is not possible, such patients will be stabilized and sent for bypass surgery at the earliest time. In the present world, the incidence of CAD is increasing and the age group at which CAD occurs is decreasing over a period of time. The main reasons for which are the stress in day-to-day life, the pollution which is increasing, and most important thing is excessive consumption of packed foods which have processed sugars, excessive trans fats and cholesterols. These are the main risk factors. And apart from this, excessive abuse of cigarettes, alcohol or even drugs like cocaine or ganja can also lead to increased incidence of CAD or acute myocardial infarctions, which are being seen more commonly in young patients in the present world.